Let's discuss the diagnosis according to 8 principles. The acute exterior imbalances. An acute condition will typically be an excess condition. This is because acute exterior conditions are usually due to the presence of qi. There may well be a concurrent deficient condition, for example, wei qi deficiency, in which case it will be a deficient or excess condition. The symptoms and signs in an exterior deficient condition will be milder than in an exterior excess condition. In addition to the symptoms and signs of an exterior condition being dependent on whether it is a deficient or excess condition, they will also be different if the condition is a hot or a cold condition. Etiology, invasion of exogenous evil qi. Symptoms and signs. As written above, there will be a considerable differences between the individual patterns depending on whether it is a heat or cold and deficient or excess condition. Some of the common symptoms and signs are as follows. Symptoms in the wei qi aspect, skin, muscle, joints, or tendons. When there is wind heat, there can be a fever or a sensation of fever. If there is a wind cold, there may be only a slight fever or fever sensation. There is headache, there is aversion to wind, and there is a superficial pulse. The key symptoms, there is a superficial pulse and aversion to wind and cold. We need to expel evil qi from the exterior, regulate wei qi. If there is a wei qi deficiency, you must simultaneously tonify wei qi. Acupuncture points, spring, LI4, lung 7, GB20, UB10, SI3, UB62, Sanjiao 5, DU14, DU16, UB12, and UB13. If there is heat, add LI11. If there is wei qi deficient, add lung 9, stomach 36, spleen 3. The needle technique is draining. Explanation, LI4, lung 7, Sanjiao 5, DU14, UB12, and UB13 activate wei qi and expel wind. GB20 and DU16 expels wind. SI3 and UB62 together activates wei qi and expel wind from the Taiyang aspect. LI11 expels wind, heat, stomach 36, lung 9, and spleen 3 tonify wei qi. For the relevant advice, when there is an acute invasion of exogenous evil qi in the exterior, it is advisable to consume beverages that are spicy, diaphoretic to open the exterior, and expel wei qi. This could be a ginger, garlic, whiskey, brandy, and chili, for example. If there is an invasion of exogenous wind cold, or mint, chrysanthemum, chamomile, or elderflower if there is an invasion of exogenous wind heat. Fasting is also advisable for only eating soup such as onion soup. There are 2 reasons for this. First, when temporarily fasting qi will not be used to transform food and therefore can be used to combat the invading evil qi. Second, some sources says that the downward movement of food and qi in the stomach can draw the exogenous evil qi inward from the surface. Similarly, the sour flavor should be avoided due to its astringent or centripetal dynamic. Vitamin C, lemon, and other things that are very sour should not be consumed during an invasion of exogenous qi cold, as they will draw the qi cold inwards while closing the pores in the skin, thereby preventing the cold from being expelled again. This also means that antibiotics are not recommended at this stage, as they are cold and drain downward. Thank you for your attention.